I am Leslie Edwards Davis. I'm the Director of Benefits for the UAW UMASS Health and Welfare Trust Fund. We provide benefits to grad employees and postdocs on campus. This is the first day of our virtual benefits fair. It's really exciting. We've already talked to tons of grad students today. We have lots of sessions left today and left throughout the week and the weekend and into Monday. So if you're interested in other topics, check out the schedule. There's so many cool classes and info sessions to attend, and there's prizes given out every day to participants. So there's definitely something interesting to partake in after today, and you should check out the schedule. I am going to introduce Julie Cogan. She is our representative from Ameritas Dental. And also on the call, we have Tita Feraud-King. She's the administrative assistant for the trust fund. She's going to help us with all the questions and answers, managing it so everyone gets a chance to ask their question. So I'm just going to start off going over some basics about trust fund benefits, how you access them, before we get into the nitty-gritty of the dental plan itself. So probably most of you have heard that 8/15, this Saturday, August 15th, is the start of open enrollment. That's a big day and you want to mark your calendar. That's the earliest day that you can fill out the online benefits application. So the site is hwtrust.geouaw.org. And there you'll find on the left-hand side of the page the grad student application. You'll send yourself a secure link to the application using your UMass email address and your student ID. And then you'll be able to select the benefits that you want to opt into. The first benefit on that page will be your dental plan. Go to the site on 8/15, just because lots of people will say, oh yeah, I have plenty of time to do that, and then they will forget to do it, and then the deadline will pass, and then it's sort of a scramble to get you back into the plan and get your enrollment taken care of. So just do it on the first day. It gets everything done early, and then that will secure your start date of coverage as September 1, as long as you're eligible. So I'm going to just share my screen with you right now so that I can show you what the benefits portal will look like when you go to our site. All right, so that should be up now. Again, you're going to go to the left-hand side of the screen to the grad employee benefits application. Again, you'll see that the link isn't live now because it doesn't open until Saturday. And once you go to the application, you'll be able to fill in all of your information and opt into the dental plan. If you are a returning grad employee, which some of you are, you do need to fill out this application again every year in order to maintain benefits. If you're a new grad employee, this is separate from your student health plan. This is not part of that plan and doesn't, you're not automatically enrolled as you are if you're taking at least 5 credits with the health plan. So you do need to proactively choose these benefits and go to the enrollment portal and sign up for them. I want to cover the costs briefly. So this plan is free for you as a working grad employee. As long as you're working at least 10 hours a week for 1 semester, you're earning enough to be eligible for all of the trust fund benefits for 12 months. And you should definitely apply. These are benefits you've earned. And even if you think you might not apply because you may have a parent's dental plan or you may have a spouse's dental plan, you should really talk to one of us and look at your options, because often our plan is more robust than other plans you might already have access to through a parent or a spouse. And often you can have both plans in place, and then there's a coordination of benefits policy that denotes which plan would be billed first. But it doesn't necessarily mean you shouldn't apply if you have something already in place. And you should ask us questions about that if you are curious about whether you should apply. So the single plan, again, is free for working grad employees. The family plan is subsidized. The cost is subsidized by the trust fund to a very affordable $100 a year. You won't find that price anywhere else for family dental. So we want to make it accessible to grad student families. And then one quick note on this year as a transition year. So we are transitioning from another dental insurance carrier to Ameritas. And so if you are a returning grad employee, I want to talk just briefly about how that transition will work. So our old plan year was structured 10/1 to September 30th of each year. We moved that year up because of the earlier semester start date this year. We didn't want people who are new employees waiting so long to get covered since the semester is starting so early. So we have moved our plan year up to 9/1 this year. So if you are a returning grad employee, your MetLife plan will end on August 31st. Your new Emeritus plan will start on 9/1. If you're a new grad employee, you weren't covered with us before, and you will be covered as of 9/1 as long as you fill out the application by the deadline. So if you were a returning grad employee, you might want to use up the benefit that you have left on the MetLife plan before our new plan starts, just to maximize your benefits. And then as of 9/1, you'll have a brand new plan year maximum to access, and it's a brand new plan. I want to say before I turn it over to Julie that we're really excited to be working with Ameritas. We went through a very rigorous bidding process this spring to find a dental plan. We do that regularly to make sure that we are using the resources that we have for benefits wisely and that we're getting the best benefit for our buck. And we got quotes from 6 different dental insurance carriers, and the Emeritus plan was an incredible plan. It allowed us to increase benefits for grad employees in a year where I think most employers you'll see will be decreasing benefits because of the economy and the pandemic, but we were able to expand and provide more for grad employees with this plan this year, and we're really excited to be able to do that. So with that, I'm just going to turn it over to Julie, and she's going to describe the plan in more depth, and then hold on to your questions or put them in the queue. We'll definitely get to them as soon as we can.
My name is Julie Cogan. I am your representative from Ameritas, and we are so happy to be the new dental carrier for UAW, UMASS, and all of you. And if you have any questions, just pop them in the chat. We'll get to them before at the end of my presentation, but basically it's just a summary. Leslie, did you want to put up the benefit summary on the screen? All right, so the plan is effective for all of your graduate students, new and coming over from last year or returning, and it's effective on September 1st, as Leslie mentioned. Ameritas has has in-network benefits and out-of-network benefits. So Leslie just popped the summary on the screen. So if you go to an in-network dentist with Ameritas, well, actually, let me first say that the Ameritas card and all dentists will take Ameritas benefits. So whether they're in-network or out-of-network are 2 different things. So if you have a dentist that you like, or if you want to see, your benefits are going to be better if you go in-network. So when you go to the dentist, and don't just ask them, do you take Ameritas? Because dentists will take Ameritas. They basically just will bill us electronically. So you want to ask them if they're in network with Ameritas. And better yet, towards the end of the call, and I believe there's a link that Leslie will share as well, on this summary, you can basically go right to our website and look up the dentist in your area, whether it's in Amherst or Greenfield or Springfield or wherever you might live out that way. And if you are not in Massachusetts, we are the 2nd and 3rd largest dental carrier in the country. So if you happen to be remote or virtual, still after September 1st, you'll be able to find dentists everywhere in the country. Okay. All right, so in-network benefits. So type 1 services, type 2 and type 3, you'll see as we go further down, they are further described. But type 1 services are things like your exams. your cleanings, any x-rays, any child sealants, things like that. So that's kind of your type 1, we call it preventive services. Those are covered at 100% in-network and out-of-network. The in-network benefits, anything in-network that's covered at 100%, you will never be balance billed for that. So the dentist accepts the fees that we will pay them. So that's one of the benefits of going in-network. The dentist will take the fees, and the fees will be what they are. You'll never be balance billed. If you do go out-of-network, the likelihood of being balance billed on a preventive service is very, very slim. However, if you go to a super expensive dentist and they may charge $200 for a cleaning, and an average cleaning may only cost $150, they may charge you the difference. So that's just one of those possible situations. It's rare, very, very rare, but if you do go to a pricey dentist, it's a possibility. So I just wanted to address that. So those coverages are 100% with no deductible, either in or out of network. If you go for type 2 services, so type 2 are things like your fillings, any oral surgeries, root canal type work, periodontal work, that type of, those types of benefits. Those are covered at 80% in network, also 80% out of network. You'll see there's no deductible for type 2 services in network, but out of network, you have a $75 deductible. And one correction actually that I just noticed, and we've looked at this 100 times, is the deductible shows a calendar year deductible, but it's actually a plan year deductible. So your plan year is going to run from September 1st to August 31st. So Leslie, I'll get that changed. I can't believe I missed that after looking at this 15,000 times.
Actually, do you want to just describe what a deductible is? Because we have folks from all over the world who have much more advanced healthcare systems than ours, and they don't have deductibles. Yep.
So a deductible is an amount of money, basically, that if a dentist charges you, let's say you need a root canal. Root canals can cost really anything. We'll use $1,000 as an example. So $1,000 root canal, if you go out of network, you are going to pay that first $75 out of your pocket. So a deductible is something that is going to come out of your pocket without any, without the insurance company paying. So that's one time $75, and that's per person in your family, up to 3 family members. So really, in essence, the maximum during a plan year that you'll spend on deductible for your family members is $225 total. So if you go to the dentist, your personal deductible is only $75. If you've got 5 other family members, your spouse and maybe some children, the most you'll ever pay is $75 for one other person and $75, so it's like for your spouse, and $75 for a child. So if that makes any sense.
And then just to underscore one more time, you're not subject to this deductible if you go in-network, and there are plenty of in-network dentists in the area and across the country, and so that you don't ever have to enter the world of deductibles if you choose not to. It's only if you have a dentist that you are really attached to, that you want to stick with, that you would experience the deductible.
Right. Thank you. Mm-hmm. All right. So then the in-network and out-of-network co-insurance, we call it's 80% that Ameritas would pay, and then you would pay the remaining 20%. And with in-network dentists, they always, just to let you know, additional savings is they always accept less their negotiated fees. So if a dentist would normally charge $1,000, let's say an out-of-network dentist charges $1,000 for something, it's highly likely that an in-network dentist may only charge between $700 and $800 for that same service. So you're saving, if you're paying 20% of something, it's best to go in-network because you're going to pay 20% of a lesser number. So that's another benefit of going to an in-network dentist.
Can I ask someone asked a question? Does a deductible apply for type 1 services at out-of-network dentists?
It does not. Only type 2 and type 3.
We have another question that was asked earlier. Will the Ameritas orthodontics benefits apply to braces that were put on before coverage starts?
Yes, they will. So if you have already, if you've that comes with a caveat. So if you yourself or your child has braces and you're in progress with braces, as long as your prior carrier, so as long as MetLife, or if you're new to the plan, your prior carrier did not pay $1,000. So the lifetime maximum for orthodontia, which I'll get to, is $1,000 per lifetime. So that does not change every carrier change. So that's one time, kind of a one-time payment. If your prior carrier did not pay that full $1,000, then we would pick up any quarterly payment that your dentist would be due up to that $1,000. So for an example, if you had the MetLife plan, and let's say you just got braces on and you had $200 got paid to MetLife, Ameritas would pick up the remaining $800 towards that lifetime maximum.
We have 2 questions. What is co-insurance?
What is co-insurance? Was that the question? Sorry.
Yes.
Yes. So co-insurance is basically an amount of money that you're going to pay. So when I say, see that 80% and that 65% under type 2 and type 3, so the co-insurance would be the remaining balance. So 80, you get to 100% eventually. So 80, and then 80% Ameritas pays, 20% co-insurance you, the employee, would pay. And then the same thing for type 3 would be 65% Ameritas would pay, co-insurance would be 35% that you would pay out of pocket.
And is a teeth cleaning considered type 1? Sorry if that was already said.
No apologies. Yes, cleanings are considered type 1 expenses, preventive coverage, yes.
Where would preventative care like mouth guards fall, and are these usually covered?
Yep. So one of the exciting new benefits that Ameritas's plan does now offer that Met did not offer is we call them occlusal guards. Try to say that multiple times fast or once. So occlusal guards are covered. They are considered a type 3 service. So you'd have to, if you go out of network, pay the deductible. But if you go in network, there's no deductible, and Ameritas would pay 65% of that occlusal guard.
Are you able to combine your current dental plan with this dental plan? If so, which insurance could be the primary insurance?
Excellent question. If you do have 2 coverages, the plan that you have prior to this plan, so any plan that you currently have, would be the primary coverage. I'm assuming the person that's asking the question does not mean the Met plan, because the Met plan, if you're currently a grad, that plan's going away. But if you have coverage through your parent or through a spouse, then you can technically carry 2 dental plans, which can be, if you have large, expensive, items coming up, can be very cost effective. But in 90% of the cases, the primary dental plan will be the one you had first.
Someone asked about deep cleaning. Does that count as type 1?
A deep cleaning. I'm guessing that's considered, or they're talking more about periodontal cleaning. Most likely, I'm going to guess. That's normally what deep cleanings, gum cleaning typically means. So that can be covered if it depends on how it's coded by your dentist. So part of it could be covered in type 1, and some of it could be covered in type 2 under periodontal non-surgical. It really just depends on how it's coded by the dentist and how it's billed. But periodontal cleanings are considered a type 1 expense. And your plan actually has 4 cleanings per year, per plan year for you. So in your prior Met plan, and correct me if I'm wrong, Leslie, there were only 2.
That's correct. That was one of the selling points among many for us joining Ameritas, is that the cleanings have expanded from 2 to 4 this year. And it's a really great benefit if you haven't had dental insurance recently. Sometimes the dentist is like, you really could use an extra cleaning this year just to bring you back up to speed. Or if you've had a lapse in coverage, it's a great extra to kind of get you back into the rhythm of having good cleanings done.
Is wisdom tooth removal type 1 or type 2?
So these are some examples, just very, a few and kind of, I guess, the most common examples of the cleanings and what type they would fall under. So what a wisdom tooth would fall under for that particular question would be complex extraction, which would be at the bottom and considered in type 2. And that would be typically done by an oral surgeon, depending in the oral surgeon's office. If you do have impacted wisdom teeth that need to come out via hospital, there can be coordination of benefits occasionally with medical carriers, depending on what type of medical coverage you have.
I want to jump in on the issue of oral surgery. So you should know that your student health plan has a limited oral surgery benefit as well, and that when you go to have oral surgery done, it's great to provide both your dental plan information and your student health plan information to the dentist to maximize your two plans and make sure that as much as possible will be covered, because the student health plan does cover those extractions in limited situations. I believe only if the wisdom teeth are impacted. So it never hurts to provide both the plan policy numbers to the dentist.
Someone asked about the summary and about the different types, and you have it in front of us.
And this is by no means a comprehensive list. There will be, if it's not out there already, a certificate of coverage with a full list of every single diagnostic code that is covered under the plan. So these that we list on the summary are just a sampling of kind of the most frequent types of benefits that we cover, frequently requested. So if there's something that you have coming that's not on here, please don't worry. I'm sure it is covered if it's a dental procedure.
Someone asked about like aesthetic dental care, like teeth whitening and veneers. Are they included?
They're not.
How about gum graft?
Gum grafts, so that would typically be considered a periodontics. So that typically will be considered under type 2. And just to say too, if you know you have something that's non-preventive, something that may fall into a type 2 or type 3 expense, like a crown or something that could run you some dollars, I always recommend, we don't require it, but we do recommend that the dentist get you a pre-treatment estimate once the plan kicks into effect. That way you'll know exactly what your out-of-pocket cost could be, so you won't have sticker shock after the fact. So we always recommend a pre-treatment estimate, and there's no cost for that.
I would also like to stress getting a pre-treatment estimate. Occasionally you will see dentists not want to do a pre-treatment estimate, and you should definitely advocate for yourself and request one, because what will happen is the dentist will send the codes for the procedures they plan to do to Ameritas. Ameritas will send back in writing to both of you a breakdown of what is covered, if anything isn't covered, what that is, and for what is covered, what your cost responsibility will be, what the dentist's original price will be, and it's all very clear and in writing, and it can just help you plan instead of being surprised.
It's a very good idea, especially for the bigger ticket items, because they can get pricey.
Speaking of pricey, being pricey, there's two questions I'm asked, both of them because they're very similar. One was, what's the maximum coverage? What does maximum coverage mean? And the other one, person asked, are there annual limits on a number of treatments?
There are no annual, so annual limits on number of treatments, I'm going to answer the second question first. So while there are no annual dollar limits, there are frequency limitations. So if you look at the left, for example, in type 1, just as an example, we talked about cleanings. You can get 4 cleanings in a 12-month period. You can get two exams in a 12-month period. You can get full panoramic x-rays once in 5 years. Your crown is once every 5 years per tooth. So those are frequency limitations, but there are no dollar limitations per treatment. The maximum for the plan year, so from 9/1 to August 31st, your maximum is $2,250 per person covered under the plan. So that is for type 1, type 2, and type 3 expenses. That does not include orthodontia. That is, so basically that maximum, what that means is what Ameritas will pay for your expenses, for your dental expenses.
And
So
that is an increase from all of our previous dental plans, whether they were with Delta years ago or with MetLife. The plan year maximum has increased from $2,000 to $2,250 to make sure that we're accommodating folks who are at that top range of dental procedures and what they're having done in a year.
yeah, and that's a great, I mean, that's a high maximum, honestly, on an average. So that's accolades to the university for that and for the union for that.
Someone mentioned about their dentists do x-rays every year. Is it covered? Because currently for type 1 seems like it's only done 1 in 5 years.
That's so full mouth panoramic x-ray is once every 5 years. That's for a full mouth, full panoramic. Very unlikely that a dentist, well, it's almost never happens that a dentist is going to do that. So your typical bite wing x-rays, when they put the little x-rays in your mouth and you're gagging when they're doing it, those are actually once every 6 months. So a lot of plans do have that once a year, but ours is actually once every 6 months that you can actually have those bite wing x-rays done.
Can you use a HSA to pay for non-cosmetic dental expenses?
Yeah, typically HSA coverage is only for medical. If it's a spouse's plan, the question probably should be directed at that plan. So have that person ask their HR folks. But typically, I know in my own company with Ameritas, our HSA only covers medical expenses. But we have a flexible spending account. So if there's a flexible spending account at that plan or a limited FSA, because if HSA is sometimes is limited, I don't want to get confuse anybody, but with an HSA, oftentimes they'll only allow limited FSA, which is for for dental and vision coverage expenses. So you can ask that whoever has that plan in place, just ask them to ask HR if dental expenses are included in HSA or if they have a limited FSA.
So I just want to jump in and get this question out of the way. Is there a waiting period before I can start using the insurance, or does it start immediately when I enroll by the 15th? So it does not start immediately when you enroll by the 15th, because we need to then check your eligibility with the grad school and then process your enrollment. But it does start soon after the 15th. So if you apply on the 15th or anytime before the end of the month, we will have you in the Ameritas system by 9/1, as long as you're eligible for the benefits. If you apply after September 1st, we're going to enroll you as soon as we can after September 1st and give you a retroactive start date to September 1st. But it is not instantaneous. If you were a grad employee last year, you are still covered on the old plan, so there will not be a gap for you. So if you need to use the old plan right away and you still have plan your maximum dollars on that plan, you can use that plan while you wait for 9/1.
Right, so I think really where we left off is just the type 3 expenses are covered at 65% by Ameritas. If you're in network, no deductible. If you're out of network, you just, again, that $75 deductible would apply, and also coverage will be paid at 65% by Ameritas. And we had mentioned previously the plan year maximum is $2,250 now. So effective 9/1/20 through 8/31/21, you'll have $2,250, and that is per person covered. So that's not a family maximum, that is per person covered under the plan. Let's see, there's no waiting period, as we talked about. You do have orthodontia coverage as well, which is a great benefit. The coverage is actually for adults as well as children. And the children do have to, the coverage for children is only up to age 19. But the fact that your plan has coverage for adults is a very rare thing nowadays. So again, kudos to the plan designer. That coverage is 50% of your orthodontia bill up to a lifetime maximum of $1,000. So if anyone has shopped orthodontia, it's a pricey adventure. So this is really where you can save some money if you go to an orthodontist that is in network, because braces, orthodontia itself can be $4,000, $5,000, $6,000. So if you go in network, it can almost cut that in half from what I've seen. And another new kind of exciting benefit that comes with the Ameritas plan, and we call it Fusion. And the Fusion benefit is something you also have a vision. So it's a benefit that fuses a vision materials reimbursement benefit with your dental plan. So you have an iMed plan. I believe everyone has the iMed plan, right, Leslie?
Yes, everyone has the opportunity to opt into the iMed plan. Yes.
Yeah. Okay. So if you wear glasses or contact lenses, what the Fusion benefit allows you to do is you can actually use part of your dental maximum, so that $2,250, you can get reimbursed up to $150 for any vision material expense that you may incur. So if you decide to, if you wear glasses, I wear contacts, and I get my annual supply, and I always run out before the end of the year. So then my vision care is done. You know, they're done. So, but I need new contacts. So I pay for the contacts. I send my form into Ameritas, and they will reimburse me up to $150 per person per year. So again, per member per year. So it's quite simple. It really is just any out-of-pocket vision materials expense. So not exam, but vision materials expense, contact lenses, lenses for your glasses or your frames, some combination thereof. You basically take that receipt. You can go to there is no network for the Fusion benefit. So you can go to 1-800-CONTACTS or, anywhere and get those materials and send that receipt in with the claim form. Or if you set up a portal, which we'll talk about at the end, with Ameritas, you can actually set up a portal, download your receipt right into the portal, and we'll send you a reimbursement for up to $150.
More of an enrollment question. Can I enroll in this plan later in the year if I have a qualifying event, like losing other coverage? Yes, you can. Two things. You can always apply for the benefit if you have a qualifying event, and we'll enroll you whenever that occurs. A qualifying event is that you lose coverage from a previous source. There are some other qualifying events, but that's the typical one. And then we also have 5 open enrollment periods throughout the year to accommodate grad employees who are coming on contract not at the beginning of the academic year. So if you miss or choose not to enroll in September, August, September, you can enroll in November 1 to November 15th. Open enrollment occurs again. Also February 1 to February 15th, April 1 to April 15th, and June 15th to June 30th. So you will not miss an opportunity to enroll. Another question, is there a maximum amount I have to pay per year? If I am over a certain amount per year, will Ameritas cover everything else? So no, that is the way that the student health plan works. I believe there's a maximum out-of-pocket amount that you can pay per year, and that is more typical of health insurance than it would be of dental. I've never heard of a dental plan that works in that way. So there's a maximum that Ameritas will pay out on your behalf each year. That's the $2,250 we described. That is per person on the plan, again, not per family, because that was also a question that was asked. Each person on the plan gets their own $2,250 to access. And after that is done, then you would be paying out of pocket until your plan renews on the next September 1st. So again, if you were enrolled last year and you still have dollars left on your MetLife plan, access those. Don't let them be wasted, particularly if you have a multi-step procedure that you need to have done. I have heard of dentists organizing that around your transition in insurance and making sure they can use part of the old plan before you transition to the new Ameritas plan. So explore that with your dentist if you have a lot of work that you need to have done and you are bridging these 2 plan years between MetLife and Ameritas. All right, Julie, if you want to.
Sure.
We'll
And just to
going back
just
and
to
forth.
absolutely, just to piggyback on one of the answers there. So if you if you're in the emeritus plan and you exhaust that and you use that $2,250 maximum before the end of your plan year because you needed a couple of crowns and root canals, which that money will go quick. If you go to an in-network dentist, they're required to, by their contract, to charge you that lesser that negotiated rate, where some other folks, if you go out of network, they're going to charge you, kind of the full cost of that root canal or their whatever that expense is. So that's another benefit of going in network, is that they are contracted to require, if you do exhaust your maximum, to charge you and continue to charge you those lesser costs, that lower fee. So just another reason to go in network.
Julie, this is a kind of detailed question. So if someone had an inlay, I believe it's an inlay, there's, and the tooth is decaying and they used their, they used their $1,000 limit. Is an inlay covered under ortho?
Shouldn't be.
No. So I might need a little bit more information from this questioner about the inlay. Is there something called an onlay, or is that supposed to be inlay?
There's both.
Okay, so it's an onlay. I'm sorry, it's an onlay. The question is about an onlay and a decaying tooth, and whether I think the 1K limit that you're referencing is an orthodontic limit, not a the general plan year maximum limit. So we might need some follow-up from that question.
Yeah. Typically, inlays and onlays would be considered, depending on, again, how they're billed, but they normally would be considered a type 3 expense that would qualify for the 2250 or be part of that 2250 max.
All right, another question. Is the discount different between the PPO and the PPO and plus network? My current dentist is listed as plus on the website. Will I get my full benefit?
Excellent question. So if you're looking up the website and they're listed as plus, the plus network is not, dentists that are in the plus network do not provide as deep a discount as someone in the regular PPO network. That's an excellent question. The benefits are discounted and they're considered an in-network dentist, but they're not as deep of discounts as if they're in the regular PPO network. Excellent question.
All right, a couple of other questions. And I'm not familiar with this happening. What if a clinic office is in network, but the dentist is not in network? Have you seen that happen?
Typically, if you have a clinic or an area that the clinic is in network, all of the dentists that are part of that will be in network typically. There can be an occasion where a dentist says, I don't want to participate in any networks or in new networks or what have you. So it is dentist specific, but it would be a rare occasion that a dentist that is part of a clinic would not be part of a network.
If that questioner has an example of the specific office, send it to us so we can look at it, because I'm not familiar with that happening locally. And I would love to just know the example if it is happening. Does the $1,000 maximum for orthodontia count toward the entire plan maximum?
Separate maximum.
They're completely separate. So if you exhaust your $1,000, that will not impinge on your $2,250.
Right.
Can you describe the process for submitting claims from out-of-network dentists?
So out-of-network dentists, most out-of-network dentists will file the claims electronically. So they would simply file the claim electronically like they would at a period. And then you would receive an EOB and a bill, so the claim would be processed by Ameritas, and then an EOB would come to you from Ameritas, and then the dentist would then send you a follow-up bill with whatever balance would be due from you. So typically in almost every dentist circumstance in today's world with electronic claims filing, dentists will file the claims online. So there's a fusion claim form, and also, like I'd mentioned, once you're on the plan, so effective 9/1, once you're in the system, you can actually create your own personal portal. Going to emeritus.com, it'll ask you to create an account if you'd like to, and you'll have full access to all of your information. You can print an ID card. You can, check your balances, check your maximum, what's left over, etc. And also upload your receipt for your fusion claim right into that portal, and we'll pay, so you don't have to fill out a paper claim form and mail it in.
Great. All right, so we've cleared out the queue of questions. Julie, where are we going next?
We're really good as far as additional savings, so additional items that would be covered under your plan. Let's see. We have through Walmart, if you purchase any eyewear in Walmart, you can actually receive a 10% discount automatically. So that's in addition to any fusion reimbursement or what have you. Just there's a card, and I can send you that link as well, Leslie. But that will be also part of your personal portal. You can just click on that and download a 10% discount for your any vision materials from Walmart. There's also a prescription savings discount card. So while you do have, if you have medical insurance, that's great. But occasionally medical insurance will come with prescription copays or deductibles, etc. And they can be pricey depending on, I'm not sure what your medical copays are. But for example, I have a prescription that I take, it's ibuprofen 800. It's just it's not over the counter, it's prescription. And what would have been a $20 copay, I used my little prescription savings card, and it ended up being $1.86. So saved me some money that way, which was nice. And that card is good for yourself, your family members. You don't have to have the dental plan. So if you have a grandmother or someone that takes diabetes medicine or something that, or chronic medication for something, I always tell people, just go online, check out the cost, and if it's cheaper than your medical copay, then jump on that. So all free of charge, part of being an Emeritus member.
All right, so I went to emeritus.com and then clicked on find a provider at the top near the address bar, and then I'm just scrolling down to dental, and then I'm going to choose a network provider. All right, I'm going to put in my zip code as Amherst. And one thing I did notice about this site, and it's really minor, but just so you know, you can't just click enter. You need to go to the drop down and make sure you select the drop down of Amherst, Mass. It says Pelham, but and then you want to choose your network, and our network is the Classic PPO and Plus. So choose your network. You can use the additional filters if you're looking for a specific dentist, or you're looking for a female dentist, or you're looking for someone who speaks a certain language. You can use all of those different filters. Right now, I'm just going to do a general search. All right, so what you'll see is that there are certain dentists that are highlighted in green and certain dentists that are not highlighted. So do you want to explain the difference for us, Julie?
Sure. So the people that are highlighted in green are typically your most cost effective. So basically your out-of-pocket cost will be most limited. So you'll have the least out-of-pocket cost if you go to a green highlighted dentist that's in your area. Those are folks that take more reduced fees than some others take. So dentists have many different contracts with Emeritus, and so those in the green are going to be your least expensive to go to for out-of-pocket cost.
And so that means that their starting price for a procedure is lower.
Yes.
That does not mean that that it's not perfectly fine to go to any of these dentists on this list. And I did want to just highlight that there are plenty of dentists in the Amherst area close to campus, if that's what you're looking for. First Advantage is a dentist that it's actually a multi-city group of dentists. There are offices in Northampton, there's offices in Greenfield, and I believe maybe Belchertown as well. There's also Market Newmarket Dentistry, which is on University Drive, and lots of our members go to that office. There's also River Valley Dental, which is a very popular dentist in our area, also the Valley Dentists. So you'll see lots of local dentists. And then the same is true, though, if you are out of state, and many of our members are out of state right now because of the pandemic. So if I put in New York City and I bring up our networks again, you'll find that you have lots of options. And in a larger metropolitan area, you'll see lots of green because there are many more dentists than in our sort of local small town, and you'll have lots to choose from. So there are dentists all across the country, just to underscore that you can go to see, and there are also plenty of dentists locally.
So just as noted before, in addition to, so the green and the, if you just clicked on Classic PPO, you're going to get a little bit of a smaller list. The Plus dentists, those that are in the Plus network, tend to be a little bit more expensive or higher cost, frankly, and they accept a lesser discount from us. So they're all great dentists. They just didn't want to be in the PPO and take those deeper discounts. So the Plus network dentists that you'll see will charge a little bit more, honestly, and the regular PPO, and especially those in green, have the most cost-effective costs for you.
And there's a question about, I think I've seen a first-time enrollment fee associated with these plans. So there is no fee associated with enrolling in these plans unless you're opting for family dental, and that is the $100 per year family premium that you would pay. Otherwise, there's no fee to enroll. If you're a working grad employee meeting those basic eligibility requirements, it's free for you to enroll. It's free for you to get your diagnostic and preventative care, the 4 cleanings per year, the x-rays according to the schedule, the exams according to the schedule. Those are all free things if you are a working grad employee. The only cost you would incur is if you are going to sign up your family, or you're going to access type 2 or type 3 services where there is a percentage that you would be responsible for. You might be thinking of GO union fees. There is a initiation fee to be part of the union, and then there are dues, but that is completely separate. These are just your employee benefits, and that's your union membership. Can I have multiple dental insurance plans? If I have coverage from another source, but it's free for me to have this coverage, is there a reason not to enroll? The short answer is there is no reason for you not to enroll, but I'll let you expand on that, Julie.
There's definitely no reason not to enroll, and if you, like I said earlier, if you want to maximize your dollars, definitely do so, because you basically can take advantage of two plan maximums during the course of a year. And some plans will run calendar year. Actually, a high percentage of plans will run calendar year. So if you need something done, you need some root canals or crowns done, keep both plans if it's cost effective for you, especially since this one's free. The primary plan will typically be the plan you had first. There are occasions that this plan would kick in, would pay first. It depends on each circumstance is going to be a little bit different. But typically your first plan that you had in place would be the primary plan.
Okay, so with that, I think we're going to wrap this call up. I want to say a couple of things in closing. Thank you, Julie. Thank you, Tita. Thank you for everyone who participated on the call. Again, it will be recorded and posted online if you need to reference it again. There is another Ameritas info session scheduled for August 25th in case you have friends who missed it and want to participate in that one. It will be posted up on our website, the time and the link for that as well. We will be picking a participant from today's call to give them an electric toothbrush, which is super exciting. And we're not going to announce it on the call. We're going to announce it on social media shortly after the call ends. So it will be on Facebook, it will be on Twitter, it will be on Instagram. You can link to those from our website. Our website is uaw-umasstrustfund.org. That's the website where you're going to find all of the documents that we just referenced, the plan description, claim forms that we will get updated, the link to find providers. All of that is under the Geo tab, under the Dental tab, and you'll be able to find everything you need there. Don't forget to apply for benefits starting on Saturday, and also we have tons of more events scheduled for the rest of today and then on Thursday through Monday. Check them out. There's a link to all of them on the front page of our website.